Hello, my name is Brian Reeve and I'm a chiropractor that's been using low-level laser for the last 4 or 5 years, and that's actually how I became involved with Medx laser. So what I'm going to do is I'm just going to go through the equipment, tell you what we have, give you a little quick demonstration on its use, some advantages of Medx laser, and away we go. So with Medx laser, what you get, this is the 1108 console, which is what most clinicians end up buying. And with the 1108, you end up with a 200 milliwatt 3-diode infrared laser at 785 nanometers. You have 2 superluminous diode clusters, each putting out 500 milliwatts, delivering red and infrared. And obviously the control console. You also get 2 sets of goggles, and you get a protocol manual to take you through various different musculoskeletal conditions that you can treat with low-level laser. So if we go through the use really quick here, it's very intuitive. It's not complicated. Right? You don't need a weekend seminar to learn how to use the equipment. So once you turn the equipment on, if you can see the screen here, what it's going to ask you first is how many ports you want to use. So if you just want to use laser, you're going to select 1 for 1 port. I'm typically using all 3 ports at the same time. I like to use laser and SLD during the treatment. So I'm going to hit 3. From this point, it's asking how much energy you want it to deliver. So depending on what you're treating, let's say I'm treating someone's C-spine, okay, I'm probably going to use about 12 joules. So we'll hit 12 joules and hit enter. And from here it's asking, do you want continuous delivery of energy? Do you want to use a pulsing mode? I'm going to use continuous, so I will hit 0. And from this point, all you have to do is hit the start button. So we'll hit start. The laser is going to start, and as you can see, the SLD clusters are working, and the laser is going to work at all. So with this equipment, one of the advantages is you can use all 3 ports at the same time. With most other equipment, it's a 1-port system. So if you're delivering laser, you got to plug your laser in, you deliver your laser. After that, you have to unplug, plug in your SLDs, and typically you have to use, if you're using red SLD, you got to plug that in, use it, unplug, and use your infrared SLD. With these, you can use all 3 ports, so you can actually be treating different areas at the same time. So with the laser, when you're using it, all you got to do is trigger it. It's going to deliver 12 joules of energy. Okay. Now all 3 ports will deliver 12 joules, so each SLD is going to deliver 12 joules as well. So I'm going to let this guy run down really quick here. So we've got 25 seconds left. So on a 200 milliwatt laser, what you're getting is it's going to deliver a joule of energy every 5 seconds. Okay. On the SLD clusters, you're delivering a joule of energy every 30 seconds. Okay. So the laser is finishing discharging. It's 12 joules. So all you have to do if you want to treat a different area is all you have to do is re-trigger it, and it's going to deliver 12 joules again. Okay. When the SLDs are done delivering their energy, you actually, let's say the SLDs have discharged 12 joules. All you have to do if you want to use the SLD clusters again is you hit the clear button twice. It's going to take you right back to the start screen. You hit start, it's going to deliver another 12 joules. So some of the advantages with Medx laser, number 1, it's very user-friendly. Let's say you have a number of people in and you're going to do a laser treatment. For myself, I'm typically using SLD and laser at the same time. So if I've got someone waiting, and let's just say I'm treating someone for a low back injury, I can put the SLDs on their low back, get that going. I'm going to be out of the room treating someone else while the SLDs are working. I come back into the room, and you can deliver your laser treatments. So it allows you to kind of be in 2 places at one time. Another advantage with the SLDs is you have hands-free capability. So say I'm treating a rotator cuff and low back, I can have the SLD strapped up on the shoulder, treating the rotator cuff while I'm using the laser on the low back. It just gives you that versatility. If you want to use 1 port at a time, you can obviously do that if you want. The other advantage is it's just, as you've seen, that the use is intuitive, it's very easy. If I grab the protocol manual, if you go through the protocol manual, it's basically got most things you're going to treat in here, right? So if we look at whiplash injuries, 3 times a week for 4 to 8 weeks, it's going to show you the dose you want to use. So it's very intuitively used, it's very easy. The protocol manual makes it really great for patients, setting them up on a treatment protocol. They know you're not just pulling something out of the air, it's established protocols, right? One of the other advantages is Medx. It's not going to break the bank. It's not going to cost you an arm and a leg, so it's got a very good ROI. The return on investment is excellent with Medx. It's easy to recoup your costs. If you really want to make laser part of your practice, with some equipment it's very expensive. You're only going to be able to afford one piece of equipment. With Medx, you can have multiple pieces of equipment be running different rooms at the same time, so it works out great. So anyhow, I've had excellent success with it. If you have any questions, you can get a hold of me. Look at the contact information at the end of this video. Okay? Thank you.